hyperkinetic disease, right? So Huntington's disease. So in this disease, we have a degeneration of the striatum. So what is the striatum doing? Question for you, Amara. That's right.
Inhibiting.
Okay, inhibiting.
Pallidus, internus, and substantia nigra pars reticularis.
Okay, what else is it inhibiting?
And also inhibiting globus pallidus externus.
Yep, that's right.
What is the striatum made of?
That's a good question.
The caudate nucleus of Buchanan.
That's right. That's right. Okay, so in Huntington's disease, we're going to have a degeneration of the striatum. All right. Remember that the caudate nucleus was in the lateral ventricles. So if there's a degeneration, the lateral ventricles are going to enlarge. All right. What is the result of this degeneration? You're going to have hyperkinetic symptoms. All right. So what are these hyperkinetic symptoms? Chorea, Ballismus, and Athetosis. These are hyperkinetic conditions. So these are motions that
Scroll up.
it's like pop-ups. Understand? It's like pop-ups occurring on your computer. Like, so the globus pallidus is like, I mean, so the basal ganglia is gone whack. You know what I mean? Like he's initiating all these freaking actions. You know. So you got these guys having all these strange motions, dancing. But anyhow, okay. So I have a little. Oh, are you good?
Yeah.
You said chorea was like if you pop-ups or ballismus?
So all of them are hyperkinetic
Okay.
symptoms.
So that's like pop-ups.
Yeah.
Okay.
So yeah.
Trying to draw a bridge, right?
Yeah.
So
Go ahead.
this is due to the.
What's going on?
This is due to the enlarged lateral ventricle, right?
Go ahead.
So then, would a communicating hydrocephaly do this too? Because like the increased CSF could cause like a lesion to the caudate nucleus.
I mean,
Does that make sense? You follow what I'm saying?
I kind of see what you're saying, but my thought process hasn't reached there yet.
Okay.
Does anyone know the answer to that? You guys were like reading the review books and stuff, so you guys might have stumbled.
One more time.
What was the question?
I honestly was listening to the question.
A communicating hydrocephalus,
Okay.
right? Increasing pressure throughout basically the path of CSF, which
Okay.
starts in the lateral ventricles.
Uh-huh.
Would that cause symptoms similar to this, right? Because you could
Probably, yeah. I see what you're saying. I see what you're saying.
You see what I'm saying?
Yeah. I see what you're saying. It probably would. It probably would. I would say, yeah. Probably would.
Okay.
So I had this little table I found, just to give you more description of the chorea, the Ballismus, and Athetosis. Again, they're hyperkinetic conditions. Just, I guess maybe something that's important for the chorea. You're having a dance like, so you can imagine somebody dancing. You know, and I was thinking, okay, so chorea, like choreography, right?
Yeah,
so someone is like
Ballismus,
dancing.
like ballistics.
Okay, that's right. Like just ballistic. I mean, he's like trying to fight you or whatever. Like literally trying to fight you.
Yeah.
Ballistics, weapons, whatever. Yeah. So violent, flinging motions, movement. Athetosis is writhing, like writhing motion or.
Oh, writhing. Okay.
Writhing. Oh, it's writhing and not writhing.
It's writhing, but I don't see an H there. It looks like it says
Yeah.
writing.
They had a
It's
typo.
just typo. Okay, but
Yeah,
it's
they had-
writhing, like
yeah.
writhing in pain.
Yeah.
And
What does that look like?
like,
YouTube. Yeah, that's a good. That's a good. That's a good. That's actually a pretty good.
That was more than I could hope for.
I'm glad I've over delivered.
That was actually pretty good. I like it. It's pretty good.
I do my best.
So this is just an image of Huntington's disease. So this is the normal person, And you can see, right? So what was supposed to be right here? Question for you, look here. You see my board, and
Board.
yeah, I gotta give you something to do.
Okay, that's because you're facing me. Right there, that's gonna be my potting nucleus.
Okay, cool. That's right.
Oh, okay, sorry.
All right, so yeah, and then this is our lateral ventricle, so we can see that it's enlarged. So why is the lateral ventricles enlarged?
Because when you degenerate, it's like it's taking tissue away, so it makes
That's
it
right.
bigger.
I'm just making sure you're with us. Yeah. Okay. So yeah, so we move on. So the idea here is that we need balanced input from the subthalamus and the striatum to have normal controlled movement. All right, so let me try to explain this. Okay, so notice this, right? The indirect pathway was going like this. The indirect pathway was going like this. Right? The direct pathway was going like this. All right? So check this out. So this right here and this right here are critical because both of them are feeding into the output. All right? So the subthalamus can be seen as a representation of the indirect. And then the striatum can be seen as a representation of the direct, because that's how the direct feeds into the output. The direct pathway feeds into the output via the striatum. The indirect pathway feeds into the output via the subthalamus. All right? So at the end of the day, there has to be a balance between these guys going into your output in order for things to be balanced. Right?
Yes.
Cool. Are you guys tired?
No,
You guys are making like funny noises. Am I the only one that's hearing this? Are you guys hearing this as well?
I think she was just brushing off her jacket.
Okay. You guys are quite the group. I'm sorry. You guys are like, oh man. Okay. Okay. So another thing to consider is dopamine. All right. Dopamine is actually going to be helping to, I guess, it's going to be having an influence on how these things are occurring. So, where's dopamine being produced?
Wait, I'm
Oh.
sorry.
Where's dopamine being produced?
Substantia nigra.
That's right, but which
What?
one?
Compacta.
Okay. And what is reticulata producing?
GABA?
That's right. It's
Okay.
producing GABA, that's right. Because it's synapsing onto the thalamus and it's having inhibitory. Right?
Is that the only place dopamine is produced?
That's the only place I remember.
Okay. That's the only place I ever hear. That's the only place I ever hear.
It might be produced somewhere else, but maybe not as much.
Okay.
All right. So it's produced by the substantia nigra compacta. So the dopamine is going to inhibit the indirect pathway, and it's going to activate the direct pathway. The D2 and the D1 are the I believe it's the receptors that it's working on. All right. Let's see how much more we got here. So we just got this to go. Believe it or not, this is the whole lecture. Okay, so all right, so okay, so this is our substantia nigra pars compacta. What is it producing?
Dopamine.
Dopamine. That's right. So here it is. Dopamine being produced. Dopamine is acting on your striatum. What is the striatum?
Glutamin in your little thalamus. So aquatic nucleus and little thalamus.
Say that one more time. I think you're guessing.
Aquatic nucleus and GPI.
striatum.
Huh?
Okay, I don't know right now. I'm looking at
Putamen and cardiac nucleus.
Okay. No worries, no worries. Okay, so putamen and what? Caudate nucleus. It's the striatum. Okay, now the dopamine, right, acting on your D1 receptor. Let's see. I'm actually getting confused now. Let's see. All right, Monfiston, I need your help, man.
Talk to me.
So let's see what's happening here.
One encourages and one
Okay, so let's see. It's okay. So for the direct pathway,
is needed.
Yep. It encourages the direct.
Its overall effect is to stimulate.
okay, cool. So it's supposed to stimulate this guy.
Mhm.
It's supposed to inhibit this guy, but I'm
Yeah.
trying to figure out how it's actually doing that.
So,
By the receptors.
so it is.
So the receptors just have a different effect on the different pathways.
There's like a gnat thing.
Uh,
So what's my striatum? My striatum. I am stimulating my striatum.
So I guess the
Yeah.
receptors on the striatum.
Oh,
right?
okay.
I'm inhibiting GPI, substantia nigra reticulata. Even
no,
more,
I think
right?
this thing right here was confusing. That was a problem. So the way you want to see this is that the striatum is always going to inhibit whatever. Striatum inhibits whatever. So in this case here, the striatum is inhibiting this guy and it's inhibiting this guy. You see what I'm saying?
Yeah.
This is actually a little bit easier to look at. I think it's better if we just look at this chart right here. So this is what substantia nigra compacta producing dopamine, right?
Mhm.
When you look at the so this right here would be for the direct, whereas this arrow right here is showing the indirect. Can you see that?
Mhm.
So basically, for your indirect pathway, this will be negative. All right. Okay, this is already here, so this would be a. All right, you guys, this is gonna be very. I think this will be very straightforward. Okay, so if we have the dopamine, all right, so it's going to be inhibiting here and it's going to be activating here. So this one is going to be for your direct and this is going to be for your indirect. Now think about this, right? So this is negative, negative, negative. So at the end of the day, this guy's going to be negative because he was positive before, all right? Because 3 negatives, that's a negative. So this guy's negative. Right? So that means that this is not being activated,
No.
right? So since this guy is not being activated, then that means that this is not being inhibited.
So you can run.
So then you get motion. So that means that the indirect pathway is being inhibited.
Yeah,
Can you see that?
Dopamine inhibits the indirect pathway.
Yes, that's right. Dopamine inhibits the indirect pathway.
Dopamine stimulates the direct.
And then for the direct, so let's see. Yeah, so dopamine has a positive influence on the striatum. That's the same thing that we have for the direct pathway. The cortex has a positive influence on the striatum, right? Dopamine has a positive influence on the striatum. So it just does what the direct pathway would normally do. So it stimulates the direct pathway, it inhibits the indirect pathway. So that's what you're supposed to see from this. Blah, 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 blah. Okay, so in Parkinson's disease, dopamine production is significantly reduced, right? Because of damage to our substantia nigra compacta.
Wait, I got a question.
Yep, go ahead.
For the D1, D2 thing, what does that
Yeah.
go with?
That's just the receptors of dopamine
So
acting.
D1 is the direct, right?
Was it direct or indirect?
D1's direct, D2's indirect. It's on the
Okay,
striatum.
yeah, that's right.
Alright.
Okay, yeah. So dopamine production is significantly reduced in Parkinson's disease because of damage to your substantia nigra compacta. So these are 3 symptoms that were important. He mentioned in class. So you got resting tremor, rigidity, and bradykinesia. bradykinesia to akinesia. So bradykinesia means slow movement to no movement. So slow movement to no movement. All right. So how do you treat the Parkinson's disease? L-dopa replacement strategy. This is the gold standard. Right. You can do some brain stimulation. You can stimulate the globus pallidus interna, and I'll go back up. I'm sorry. Apologize. Render my apologies.
Did he say what kind of rigidity you did?
Oh. Yeah, he just had a bullet point.
Cogwheel and lead pipe.
What's the difference?
No, you get cogwheel and lead pipe rigidity with Parkinson's.
No, I'm saying what is cogwheel? What is lead pipe?
This is cogwheel, right?
Cogwheels.
Mm-hmm.
Just in your arm?
Oh,
it's,
well,
it's
that's
the
just the
motion.
mo- the
it's
motion.
like very staccato. Okay, and then what's lead pipe?
I don't know what lead pipe is.
Google. All right, yeah. So L-dopa is a replacement. L-dopa replacement strategies, gold standard. You can do some deep brain stimulations. You can do brain transplant.
What?
Yeah, some of them I think he said haven't been tested.
Or you got on the side.
Huh?
Then stereotaxic lesion of your GPI. Stereotaxic lesion of your GPI. Cool.
Yes. Very cool.
Okay, so there has to be a balance between the two pathways. All right, in the basal ganglia to have normal movements. What are the two pathways? Direct and indirect. If there's an imbalance, it will result in what? Dyskinesia. If there's more indirect pathway acting, that means that what? We're not gonna have a lot of motion, right? Because we're gonna get hypokinesia. If there's more direct pathway, we're gonna have more motion, so that's gonna be hyperkinesia. And this is what this is showing here. So this is normal. Everything is level, right? So we have more indirect pathway. So okay, if we have more indirect pathway, what do we have?
Bradykinesia.
Is that what we said? You say that.
If you have,
No.
if you have what?
If we-
If you have more input to the indirect pathway,
Yeah, if we have more indirect pathway, yeah. What would we have?
decreased movement, aka bradykinesia.
That wasn't the term we used
Bradykinesia
though.
is slow movement.
That's,
It's
I mean,
decreased movement.
you're right, but that wasn't the term that we used though.
Oh, you wanted me to use the exact same terminology.
Yeah.
Oh, okay.
So more indirect
Yeah.
equals slow movement?
Less movement.
That's
So
Oh,
what was the term?
indirect,
What was the term
sorry.
for that? What was the term for that?
Hypokinetic.
Hypokinetic. Okay, and then if there is more direct, it's hyper. So what does dopamine do to the I'm just picking on you. What does dopamine do to the direct pathway?
To the direct pathway,
Yeah.
it stimulates the direct pathway.
That's right. Through what receptor?
D1.
You're pretty good. Pretty good. Okay. Cool, that's it. That's the lecture right there.
Can you email this to me?
Yeah, I'm gonna email it to you guys.
Wait, go back
But you
to
guys
the
should
bottom though.
you guys should
God bless you, Moses.
no worries. No worries, man. I'm here